Hello, hello. If I'm not wrong, am I speaking with Mr. John?
Yes, that is correct, nurse.
And how may I address you, sir?
You can call me John.
Right, John. My name is Monica, and I will be your attending nurse today. Now, I understand that you have come here to have the stitches removed and for your wound dressing, right?
Yes, that's right, nurse.
Now, before I proceed further, do tell me if you have any questions or concerns that I can address for you, John.
Well, there's one thing actually. The doctor told me earlier that I had something called squamous cell carcinoma, which I just think is another name for skin cancer. Now, obviously, you hear the word cancer and you're worried as a person, so I'm a little worried about that, nurse.
I see. Well, while I understand your concern, John, I would like to give you a bit more information about squamous cell carcinoma. May I?
Sure, nurse.
So, you're right, John. It is a type of skin cancer which is caused by sun exposure or exposure to ultraviolet radiation. However, I want to reassure you that the surgery you had to remove your lesion is quite effective. So, it is very unlikely that this particular cancer will spread. Moreover, in order to make sure that it does not spread, it is important to keep checking for new or changing spots with the help of regular doctor checkups. Do you understand, John?
I understand, nurse. I have a better understanding of what squamous cell carcinoma is now, but will I need more surgery to remove these lesions in the future, nurse?
Well, while that is a reasonable concern you have, John, I would suggest that you discuss this with the doctor during your follow up appointment, since he is the right person to answer this question. Am I clear?
Yes, nurse, you're clear.
All right. What I would like to do now is discuss with you about your habits in the sun. So, for that, can you tell me, John, how do you protect yourself from the sun?
Well, I always wear a high factor sunscreen, which is 30 or higher, because I know how important it is to wear sunscreen now. And I also wear a hat whenever I'm out in the sun. But I don't know, nurse. I just think that it's too late for me because the damage has already been done. I spent too much time in the sun in my teenage years, and now I'm paying for it.
Well, I can understand why you may think that, John, but I assure you that it's not too late for you. And we do need to keep using these measures to prevent from the harmful sun rays. Ongoing prevention is still very much crucial to prevent further sun damage. All right?
Okay, nurse. I'll look after my skin in the sun and I'll continue to follow these measures.
That's good to hear, John. Now, how is your wound after the surgery?
The wound is fine, nurse.
Are you experiencing any pain or discharge at the wound area, John?
No, nurse, there's no pain or discharge, but I still think it's too early to have the stitches out.
Well, I understand your perspective, John, but I'm afraid it's quite necessary to have the stitches removed now to encourage wound healing. Also, the wound has already been assessed by the doctor, and it is a common phenomena to remove the stitches after 7 to 14 days. After the stitches removal, there are a few things which you need to do to look after the wound as well. May I discuss those with you?
Sure, nurse.
Alright, so firstly, you have to make sure that you keep the wound clean and dry always. And secondly, ensure that it is always covered to prevent any sort of infection. Will you be able to follow these measures, John?
Yeah, sure, nurse, I'll do that.
Alright, so can I proceed to remove your stitches now, John?
Yeah, definitely, nurse, you can go ahead.
And there isn't anything that you would like to ask me.
No, nurse, I don't think I have any more questions.